When Julian came to be evaluated at Northwestern Medicine for his conditions, we wanted to take a fresh look at him and have a comprehensive evaluation of his conditions. Where he was evaluated initially in New York in a very good place, but it's a common scenario we face where either these diagnoses of pericardial disease are missed or they go the wrong route. He was told that he has a liver issue and fluid in his belly, and that he has liver cirrhosis. And they found that in some of his imaging that the right upper chamber of his heart is enlarged. And because of his symptoms of breathing issues and not, they were talking about heart transplant, liver transplant, and so on. So we've evaluated him with repeat, fresh, comprehensive echocardiography exam as well as cardiac CTs. We came to the conclusion that he has not per se primary muscle heart problem or a disease process in the liver and the heart that needs a transplant, but rather than we have a potentially reversible cause of his symptoms that can hopefully give this young man a more optimistic prognosis down the road than they initially thought. We found that his pericardium is very calcified and basically constraining the heart and boxing the heart. In his case, unfortunately, we could not use just medical therapy to reverse it because it was already calcified and kind of almost like an eggshell boxing the heart. Thankfully, in a pericardial center of excellence like ours, we have the diagnostic needs with advanced imaging, we have the medical expertise and the surgical expertise. So in his case, very rapidly, after we finished our diagnostic workup, we started the medical optimization by removing the extra fluids, controlling his arrhythmia, that he had abnormal disturbances of the rhythm of the heart as a result of this condition. And we involved our chief of cardiac surgery, who is probably the world expert in pericardial surgery, among other cardiac surgeries. Dr. Johnston was able to do radical pericardectomy, which, as the name suggests, we remove every single piece of the pericardium to prevent the chance of recurrence of constriction down the road. That's our preferred approach here. Following surgery, he did it was an expedited pathway for discharge, and he showed amazing clinical response in terms of how he felt, and his imaging showed that his chambers of the heart had shrunk in size, especially the upper chambers, as a result of the surgery. And it tells you that he did a great job by coming early to us, and Dr. Johnson did a great job by operating as soon as he could to help relieve the constriction. His prognosis from a medical standpoint looks great. The most important thing in these conditions is early referral or early recognition, because many times those patients come for unexplained breathing problem or swelling in the stomach or fluid reaccumulation around the lung. And people are investigating, let's say, primary liver problem or primary lung problem or some other forms of heart issues. But in reality, it could have been a reversible cause, and it can change how they feel dramatically and improves their survival, and reverse, in many cases, especially in earlier of the course of the disease, any end organ damage, whether kidney and liver in particular.